It's a very, very thin product. I'm gonna pass it over to Norm.
Oh, yeah.
It's probably about 1.5 millimeters thick that goes on the tooth. A lot of people, it takes them about a day to get used to it, and the speech is really not altered. And I would almost bet you that you know somebody at work or a friend that's wearing Invisalign right now that hasn't told you, and you haven't noticed a change in their speech, and they're going through their orthodontic treatment. A lot of adults aren't really forward about telling you that, oh, I have it. You know,
Yeah.
kids, young kids, they get braces with colors on them, and they're the first to show their
Yeah.
friends and show their family
Look
that
at
I have
that.
colors on my braces. But adults, we like to do things a little bit more discreetly, and that's the beauty of Invisalign.
I would think just by comparing two of the models that the doctors brought in today, it strikes me that Invisalign would be far easier to get used to and far less effective on things like speech and things like that. It just seems to me, putting them over your teeth like that would be, something that would take a little bit of getting used to, but far, far easier and far less effect than having traditional braces on the teeth.
Absolutely. And the other thing that I find with the Invisalign Teen, which, like I said, most teenagers by the time they're 12, 13 have all their adult teeth.
Mhm.
So Invisalign's come out with a product a couple of years ago called Invisalign Teen that's a little more catered to teenagers. With teenagers, a lot of times they play musical instruments,
Mhm.
okay, where their lips are pressed up against the teeth. And with Invisalign, I tell them you can try and play with your instrument with the Invisalign on. If you find they're slipping, I know for some woodwind instruments like the saxophone, your
Yes.
teeth are pressed right up against the top of the mouthpiece. I play a little bit of saxophone, by the way, and that's why I know. But they can always remove it if they find it's a hindrance. If they remove it, most kids are practicing maybe 30 minutes to an hour a day. It's not going to affect their treatment, and they can still progress with their musical instruments. Whereas braces, a lot of times, they stick out a little bit more. There's a little bit more irritation on the inside of the lips.
Yeah.
So the comfort level with Invisalign is definitely an advantage over braces.
Okay, hope that helps you. Okay, take care,
Thank
Chris. Bye-bye. Yeah, that's interesting. You talk about teenagers. It would strike me that, once you get to be my age, for example, if you have to have braces, you have to have braces. You're going to put up with it. Teenagers, though, it's an image thing. It's, and it's kind of interesting that you talk about Invisalign being invisible. You talk about some cases where Invisalign may not work right off the bat, so you have to go to traditional braces. And to answer that problem, you've got, as you're just showing me, almost like multicolored precious stones as part of the braces themselves.
Absolutely. And, it's kind of one of those things where children in their early teenage years, there's some of them that come into the office and they want the traditional braces with the colors. And I tell them they're like little pieces of jewelry on your teeth.
Yeah.
You really have to take care of them. They are delicate. When we bond the braces on, there's a certain strength that's required to move the tooth. But the bond strength can't be too high that when we go to remove them after the treatment, we're going to damage the tooth. So there's a bit of a release factor. So they have to be careful in what they eat, or braces come off. So what we normally do, if the patient is a candidate for either Invisalign or braces, we give them the option.
Mm-hmm.
But if there's a 13-year-old girl or a 14-year-old girl and you want to put colored braces on her, more times than not, she will run out of the office as fast as can be, and they're looking more to Invisalign.
It's an image thing. It's, they're developing their self-image.
Absolutely. Or 12-year-old boys who start gelling their hair in the morning. I think a lot of us were at that stage at one point.
Yeah.
They don't want braces on their teeth.
Yeah. So that's where Invisalign comes in?
That's where Invisalign Teen comes in.
Yeah. Now, when you're looking at Invisalign Teen, because I'd like to just continue that, until we take a break for the news here. When you're looking at that particular product here, what is it that makes it stand out for teenagers?
Well, one of the biggest things is you try and tell a teenager you can't chew gum, you can't eat pizza crust, you can't do this, clean your room, do the chores.
Yeah.
Poor teenagers, we sometimes got to stand back. They're going through puberty, they're going through, early teen, midlife, but not
Yeah.
midlife crisis. It's one of those things, the parents are almost insisting that they get their teeth straightened, and the other pressure is they want to have nice graduation photos for the time they finish high school. It's one of those things where if we can make their lives a little more comfortable, not restrict them so much with what they eat, and it's something that they're interested in doing, it's a great alternative to braces.
Now, one of the interesting things about the up-to-date facilities over at Orleans Orthodontics is you have some great videos showing your patients exactly what happens to the mouth when these braces work. I mean, that was one of the things that always got me. I could never see the end result.
Absolutely, and that's one of the nice things here about Invisalign is before we even start the treatment, we can show the patient what their teeth are going to look like at the end of treatment.
Yeah.
And that is just phenomenal. And what we do is our patients, if they would like, we email them this video.
Yeah.
So after we take the impressions of their teeth and the diagnostic records, an email is sent to them showing them, okay, this is the before, this is the after. Are you happy? Most of the times they are very happy before we order it for them. A lot of times they trust me, they trust my work, they've seen other people or they've been referred by somebody else, and they know that the end result will be very, very nice.
Yeah.
But with regular braces, it's kind of, we're imagining this is the final result and we'll put the teeth in their proper position. So a huge, and once again, technology, it's a big bonus with Invisalign that's to everybody's benefit.
Yeah. Now, Doctor, we were talking just before the break about the benefits of Invisalign in terms of the comfort, the fact you can remove them while you eat, which makes a huge difference because, there are restrictions on what you should be eating when you have regular wire braces on. Let's talk a bit about the practice of orthodontics itself and the need for braces. When it's decided you need braces, first of all, when you go in for an assessment, you don't need a reference from a dentist for this. You're not, if you think that your teeth are maybe a little bit out of whack, all they have to do is give your office a call and set up an appointment.
Absolutely, Norm. That's a very good point. Because orthodontics or an orthodontist is a specialist in the dental field, there's a misconception that a referral is required.
Mm-hmm.
Now, if you need a root canal, Norm, you're probably not going to know you need a root canal until your dentist tells you you need a root canal. You're not going to walk into an endodontic clinic and say, I need a root canal. Orthodontics is a little bit different. It's quite apparent that the teeth are either misaligned or there's space between your teeth. A lot of people, one of the other big things we do is close spaces for people for aesthetic reasons, or food gets caught between the teeth. So a lot of people, they know there's something wrong with their mouth, or they have an issue, or let's just say you're biting your cheek because the back teeth, which for example, the top teeth are normally on the outside, the bottom teeth are on the inside. And if the opposite occurs, is what we call a crossbite, sometimes people are biting their cheek. And the true correction of that is to put the teeth in the right position.
Mm-hmm.
So with orthodontics, if you suspect something, or if your child has something, or you're just, wanting to make sure that everything is developing, a consultation is always a good idea, and no referral is required.
I guess, too, it's one of those things that maybe we should be getting into the habit of doing, is bringing our children in, as you say, from the age of 7, on a regular basis, to have our orthodontic health checked on a regular basis.
Absolutely, and it's one of those things, an ounce of prevention is worth a pound of cure. And it's very reassuring for me and for the parents to tell them, your child at 7, everything's developing normal. Let's see them again in a year and just make sure that everything's coming in properly. A lot of times, unfortunately, what ends up happening is they come into my office and there's a problem, and that's where we address the problem and correct it. So, whether you're talking about maintaining your car or maintaining your air conditioner once a year and doing a little bit of maintenance and just having it checked out, or just waiting for problems to arise, it goes back to, it doesn't hurt to have a consultation. And I'm very happy when I see patients that have a nice healthy teeth or nice healthy bite, and I tell them, either you don't need orthodontic work, or let's see you back in a year.